So as we were saying, there's about 500,000 guys that are dealing with this disease inside the VA today. There was some.
Hey guys, excuse me. Hey, Mike.
Hi, how are you today?
Good to see you. Good. I see you're out here educating our volunteers and our veterans. The folks from Telix, ladies, welcome.
Yes, thank you.
Great pharmaceutical organization, and you're out here promoting prostate cancer awareness.
We are. I'm the president of Veterans Prostate Cancer Awareness. We're a nonprofit. What we do is educate and raise awareness to the veteran community primarily. We'll talk to any man, but most of it's focused on the veteran community.
Yeah, and veterans are at a higher incidence of prostate cancer, 1 in 5 as opposed to 1 in 8 in the general population.
That's
right?
true. And we have about 500,000 vets inside the VA today that are living with this disease. We see about 15,000 new cases every year. So it's critical that we get in to do our PSA test and know your number.
Yeah, I was going to say, it's an important phrase, know your number, right?
It is, and you should know it like you know your birthday. It's an annual test, it's a blood test, it's non-invasive, and you need to know that number. If it's elevated above a 1.5, you need to start paying attention, because the earlier you can detect this, the better chances you have are treating it.
Well, Telix steps up, and they have advancements in early detection and all sorts of treatment. Tell me how that works.
They do. One of our sponsors is Telix. They put vets first. They put us out there. They really help support us in all of our mission of educating guys. But Telix makes a product called Illiccix. And Illiccix is a PSMA, so a prostate-specific membrane antigen that you inject into your body. It's a nuclear pharmaceutical that you inject in, and it actually lights up when you send yourself through the PET CT scanner.
So Mike, what makes Illiccix so much different and more effective?
Illiccix, the way it's developed, it's a nuclear medicine, and it's much more accurate than conventional imaging. It's moving into what we call now refer to as precision imaging. And it's, again, it's non-invasive. It's a simple injection, and then you run through the non-invasive PET CT scanner to develop these images.
And you know exactly about this firsthand. Fortunately, you are a prostate cancer survivor, right,
I am
Mike?
a 3-time survivor of prostate cancer, and I am here because of the technology that Telix provides. Every time I've had a scan, it's changed the direction of the course of my treatment. So I highly encourage everybody to start learning about it and understand what Illiccix can do for you, and bring out its new technology, the accuracy that's provided for the doctors to see. It actually shows you in your body where that cancer is.
Well, Mike, I'll let you get back to educating our volunteers and our veterans. Keep up the good work. Thank you, Telix.
Thank you.
And I'm going to go get changed, meet our family back at the lake, and I promise, Rob, I'll have them get one on the line for you.
Thank you so much, Art.
So guys, we're back to the 3D color picture stuff that's so accurate. It's just amazing when you see it.
There is a risk PET scan images with Illiccix may be misinterpreted or may be affected by other factors. Illiccix involves exposure to small amounts of radioactivity. Long-term cumulative radiation exposure is associated with increased cancer risk. The most commonly reported adverse reactions include fatigue, nausea, constipation, and vomiting. These adverse reactions each typically occurred in less than 1.2% of patients in clinical trials. This is not the full important safety information. The approved uses and additional safety information is available at illiccix.com/safety-information.